Welcome back. One of our own employees at DHHR adopted 2 young children. Joining me now is Monica Robinson to tell us more about her own personal experience with adoption. Monica, thank you for being here.
Thank you for having me.
I know that you and your husband have adopted 2 children. Can you tell us a little bit about that experience?
Yes, we have an older daughter named Madeline that's 12, and she's biological, and we decided to add to our family through adoption, and we currently have a 4-year-old little girl named Marley, as well as a 6-month-old named Megan.
Wow, that's great. It's exciting for you, I know. What made you decide adoption was good for you and your family?
It was something that was always laid on my husband and my heart even before we even started having children. And through interactions with friends through Mission West Virginia, as well as mission work that we do in other countries, we just decided that that was definitely a way we wanted to go. There's so many children available in West Virginia and around the world that we wanted to contribute and raise those children in a loving home.
You know, it's wonderful. It warms my heart to hear you talk about it because you're exactly right. I mean, as we heard earlier in our segment, we have many children out there eligible for adoption, and certainly the fact that, you and your husband are contributing to helping, your new part of your family, your 2 children, is critical. What is the first step? Help our viewers understand, because I think sometimes people are challenged because they don't know, what do I need to do and how hard is it? Can you tell us about that?
Absolutely. The first step we actually took was just talking to other people that we knew that had gone through the process and finding out through them what they went through and who we should talk to and direct us. And then, reach out to DHHR, do your research on websites, Mission West Virginia, obviously, the various agencies, and decide basically who you maybe have a comfort level with to reach out to you, and then just get as much information as you can. And then once you decide to pull the trigger, so to speak, you contact a social worker, and basically you start filling out paperwork, and they guide you through the process until you get to where you want to be.
Now, I know one question that's frequently asked is, how long does that take? I think everyone's always interested in that.
It's a little different for everybody, but primarily the initial process as far as going through the classes, getting the home study completed, filling out the paperwork takes approximately 6 to 8 months. And then a few more months take place after that for whatever agency you go through to look at all the paperwork and finalize your home study and approve you to be a foster adoptive parent.
Now, I know that people may think, well, that's a long time and that's a lot of work that you have to go through, but there's reasons for that, isn't there?
Absolutely, absolutely. We want these children to have good homes. We want them to be with, there's background checks. There's just a lot of training, actually. It's not even as much as looking at the family, but training the family to welcome these children into their home and to give them the information that they need to understand the process, because it's, in a lot of foster situations and adoptive situations, you're dealing with legal issues and navigating a legal system as well as a social system, and there's a lot of information and a lot of things to learn.
Now, how did your children that were adopted, how did they adjust to their new home?
Well, we have a unique situation. Ironically, we went into adoption to adopt older children because of our daughter's now 12, and she was 6 or 7 when we first started this process. We got younger children, and so they have adapted very well. What was interesting was seeing how our family adapted to having these children, and it's gone so well. Everybody is just very happy to have these children in our home.
What kind of false assumptions do you think that are out there about adopting through the state or going through this process?
I think a lot of people think it's too hard. A lot of people think it's expensive, and currently and for the last several years in the state of West Virginia, if you become a foster adoptive parent in the state, it's to no cost of your own, unless you adopt, and then there might be some legal fees associated with that, but they're very minor compared to the cost of, say, international adoption.
And I think that is important for people to know. There are children out there. There's no cost. If you want a child into your home, there are children out there available for you.
Absolutely. I've often joked that my 2 adoptive children have cost me less than my biological child from
Right.
an insurance standpoint.
Now, what advice would you give individuals that are considering adoption?
I would definitely tell them to reach out to parents that they already know that are in the foster adoptive arena, talk to them, and then reach out to the various agencies, DHHR, Mission West Virginia. You know, again, just do your research and talk to as many people involved in the process as you can.
What kind of tips would you give individuals who are getting ready to bring a new child into their home or become an adoptive parent?
I think that the main tip is to know you and your family, and to be honest as far as the type of child that you can bring into your home and realistically provide for them. I think that's very important. I also think it's very important just to be open-minded and flexible, and because you may get a call and 2 hours later have a child in your home. And so you just have to kind of roll with the punches and make your way through the process and just be flexible.
Are there any that you're aware of, you know, support groups or, you know, individuals who, you know, get together to talk about this? And because I think that is helpful for people to sort of continue to support each other either during the process or even after adoption.
Absolutely. We are currently involved in a support group that we have in the Putnam County, Kanawha County area through the agency that we adopted through. And we meet with foster and adoptive families on a regular basis. It's basically on a monthly basis. And we sit around, we talk, we share stories, we support each other, and just we celebrate the good things and we cry with each other through the hard things. But it's very, very important, I believe, to have that support and that structure.
Now, that support group that you have, I'm sure you have, there are many people in that support group that are continuing the process to either adopt other children or foster children. What would be the final words that you would say out there to anyone who hasn't considered it or is, you know, vaguely thinking about it? How do we get them interested?
Absolutely. First of all, it's one of the most rewarding things I've ever done and my husband's ever done in our family. But secondly, what I tell people, even if they're not absolutely sure, just start the process. You control through it. Just start the process. You're never going to get a child if you're not approved.
Yeah.
So just go through the process and get started and see where it takes you.
Thank you, Monica. That's all the time we have for today's show. Remember, you can always follow us on Facebook, Twitter, and our website. Thank you for watching The State of Health here on the Library Television Network.